7 serious misconceptions about psoriasis. Psoriasis is a skin condition that affects many people and is difficult to treat. It is surrounded by many misconceptions. The disease can develop at any age between 15 and 35 years and is equally common in men and women. It affects on average 3% of the population worldwide, around 100 to 125 million people. Also known as psoriasis, it causes itchy, painful skin irritation, most commonly on the elbows, knees and scalp. It can only be relieved with a variety of treatments, but not cured permanently. Misconception 1. Psoriasis is contagious. The reddish-white crusty patches of skin, the pus-filled nodules, are not infected in any way, and there is no fear of spreading the disease through contact. Misconception 2. It is only temporary dermatitis. Psoriasis is a chronic skin disorder of genetic origin, triggered by environmental and immune factors. When the latter reach a threshold, the patient develops latent psoriasis. This is when the immune system overactivity is telling the body to replace skin cells every 4 to 5 days instead of the usual 21 to 28 days. Misconception 3. There is only one type of psoriasis. Although plaque psoriasis affects 80 to 90% of patients, there are 6 other types of psoriasis. Misconception 4. People who don't wash enough will get psoriasis. This is a misconception regularly faced by people who develop scalp psoriasis. It is all too visible. However, scalp psoriasis is not caused by poor personal hygiene, and therefore its treatment can be solved by simple change of shampoo. Misconception 5. Psoriasis is essentially eczema. Eczema does not indeed cause similar symptoms, itchy, inflamed skin, to psoriasis, but the cause is different. There is about 1 psoriasis for every 4 eczema sufferers. However, it is possible to have eczema and psoriasis at the same time. Misconception 6. Just a few dietary changes can get rid of psoriasis. People with psoriasis are often advised to switch to a gluten-free diet, avoid sugar and dairy products, and avoid potatoes. But this may not always work, or it can be too stressful to make a complete lifestyle change, which can actually make the psoriasis worse. Misconception 7. Psoriasis only occurs on the skin. Patients with psoriasis may also be at risk of at least 10 associated diseases, including depression, circulatory diseases, arthritis, Crohn's diseases, diabetes. Depression is perhaps the most common problem they have to deal with twice as many mental health problems as the general population. Depression affects self-esteem, relationships, quality of life, and sleep. In other words, psoriasis can cause problems well beyond the surface of the skin, deep down in the psyche, and these need to be treated immediately. Although, as far as we know, the onset of the disease cannot be prevented and the disease cannot be cured permanently. As with many things, herbs can help you. The first priority in the treatment of psoriasis is the proper selection of various special creams. A well-chosen herbal cream therapy can not only make psoriasis symptoms free, but can also greatly improve the quality of life. Psorisot Extra Balm contains high active ingredients and extracts of 11 special herbs that naturally care for psoriasis.